and welcome. I'm Debbie Nelson from Alternative to Meds podcast, and I am so excited that I've gone after the Integrative Psychiatry Institute and said, yes, here's something that is further training doctors who are responsibly wanting to help people with mental health. So I have the founders today, Dr. B and Dr. Keith Kurlander. Hello, guys.
I'm actually not a doctor. I'm a psychotherapist, but that's okay.
Okay.
Yeah.
Sorry. All right, guys. When I answer the phone, I work with Alternative to Meds, and on a daily basis, we receive hundreds of calls, and individuals are seeking doctors who are trained in other than symptomatically prescribing the medication for their mental health needs. So when I first was introduced to your school, I was beyond excited to think that there's professionals out there that are seeing the need to get further trained. And we need to connect with you. And there's so many people that are so excited about your work. So welcome. I would love for you to share your work. Like, what inspired you guys to start the school?
It's a good story.
Can I start?
Yeah, I can start.
Go ahead.
Sure.
Yeah.
Well, Will and I have known each other for, I don't know, 12 years probably.
Yeah, over 10 years.
Yeah. We've worked very closely professionally, but also we're close personal friends. And we were talking about for a while about starting something in terms of getting integrative psychiatry, integrative medicine to the broader public and how we would go about doing that. And a couple of years, 2.5 years ago, is when we sort of individually kind of came to our own reasons about why the Institute needed to exist. I guess we have kind of our mini stories that are different there.
Yeah.
But the bigger story is we're both just really passionate about changing the conversation in mental health care and really looking at root causes of why people suffer and actually looking at the treatments that can help people with those root causes. And often those treatments are not pharmaceuticals. Sometimes they are, but often they're not. And so we're just really passionate about educating providers about what root causes are out there for mental illness and also what the treatments are. And then also we have a clinic too in Boulder where we practice these things in the clinic with our team. You want to add to that?
Sure. Well, should we get into the kind of story behind why we started this thing in the first place? So
Yeah.
For me, so I'm a trained psychiatrist. When I got out of residency in 2002, I started a practice and I had the skills that I had learned, which worked okay for some people, but there were way too many people who weren't getting well with medications and the traditional psychotherapy that I had learned how to provide people. At first, I found Buddhism and meditation. I started teaching people to meditate, and I thought, okay, now I'm an integrative provider because I'm doing meditation with medication and therapy. I thought it was a big deal because I had a third thing that I could use for people. But it turned out that helped some people, but it didn't do anywhere near enough to help the people who were responding to meds and therapy. So by the time I got to 2004, I had gotten board certified in psychiatry, but I was very unhappy with the results I was getting. And I actually was frustrated enough that I quit psychiatry to go looking for answers. And I had the good fortune, it was very humbling, but I had the good fortune of running into a former patient who had not responded to the SSRI and the cognitive behavioral therapy that we'd done once a week for a year. And he told me that he had gone and been tested for celiac disease. And when he got that diagnosis and he stopped eating wheat, all of the anxiety that he had that had not responded well to meds or therapy melted away in a few weeks. And then he tapered himself off his medications and he still had no anxiety. So for me, as a physician and as a psychiatrist, it was just a massive wake-up call for me that there were other ways to look for root causes and things that we could do that could actually resolve that rather than putting a Band-Aid on it and trying to just suppress these suppressive therapies. We know, again, we still use medications in our clinic. We're not anti-medication, but we want medication to be used in the right situation and at the right doses for the right period of time. And I think we're pretty aligned with you that a lot of people are medicated, then, okay, now there's a side effect, put another medication on, or, okay, it's not working, let's add another medication. And pretty soon people are on a boatload of medication, and there's no discussion about coming off medications. There's no awareness for most practitioners about what are you actually trying to do? What's the root cause?
Right.
So from 2004 to about 2014, I was just on a 10-year trip of going to every CME weekend I could find and learning about gut-brain connection and hormones and inflammation. I reconnected with someone, I think Dan Engel, talking about TBI and how that could impact mental health, and so many different things that we can actually look at to help people get. The goal, I think, needs to be getting people out of the system, eventually. But it needs to be done with care and a lot of responsibility. And so a couple years ago, Keith and I came together, as he said, and I realized that teaching practitioners in little weekend workshops wasn't giving them enough tools to actually be able to successfully taper people off meds and look at the root causes and get them on more natural programs. And so we developed this year-long training because we felt that the journey I took over 10 years could be condensed into 1 or 2 years of training, and we could get thousands of people trained. Our goal is to have 10,000 practitioners trained in the next 10 years. And if we do that, I think we've been in the arc of mental health care in this country.
Yes.
And it's been great to see how much, not just on the patient side, but on the practitioner side, there's a huge amount of interest in this kind of stuff right now, which is great. So we have people from Canada and Australia, India, and I think even South America have enrolled in our program. So it's been great. People are excited to learn these things.
I think what's exciting is that there's starting to be a connection that people are, like, most individuals will say, well, it has nothing to do with what I'm eating. My doctor says it has nothing to do with that. And I'll say, well, it has a lot to do with it. Like your mental health, our body, everything is all connected. And scientifically, what's exciting is that there's more and more evidence that people now are getting aware of the gut-brain connection, the microbiome.
Right.
There's so much more that goes into mental health. And what's sad is that people are symptomatically, like I said, being diagnosed, labeled, and no one's looking at what's driving it. So when I say, like, an integrative approach, that is irresponsible. That it isn't negating what medicine is giving to us. It's not. It's just what is driving, what's the symptoms going on, so that a person's not reliant on something that is incredibly toxic to the body long term. So what avenues what canons of information do your people learn when they go through your program?
Well, we divide our program into 3 core areas of learning. If we're talking just about our fellowship, then everyone gets educated in integrative medicine in the area of the body, which is primarily functional medicine for mental health.
Right.
Then they get an education in the psychological sciences, and that spans a lot of knowledge around the neuroscience of trauma and how that impacts individuals' mental health and wellness, and as well as we kind of lump in our spirituality sections in there, meaning making, and how much purpose is relevant to people's mental health, and then also lifestyle medicine is the 3rd core area of learning, and that's where we include things like nutrition and exercise and things that are played out through behavior, sleep. So really, relationships, where we're looking at things that are external to the body and how that gets played out. And there's like 15 modules that are spread out through those three core areas. And each area has its own focus. In the functional medicine, we obviously take a really deep dive into the gut-brain axis, because that's a major aspect of functional medicine for mental health. And we're obviously also looking a lot at the evidence base behind supplements. Our institute we've really taken the position in the institute to really lean as much as we can on evidence.
Right.
And that's something we both believe in. We feel like we're going to have others there for actually doing treatments that will reliably work, but
Right.
also a way to further the movement, the revolution of medicine itself. We need evidence to actually speak the language and to practice science. And so really the institute is really a scientifically driven institute in that way.
Yeah, that's the Dr. Britz, who is our neurochemist naturopath that's on with us. It's amazing because she'll take a functional medicine and people will say, well, I get my labs done. And it's trying to explain that a functional medicine, what they're looking for is a functional medicine doctor knows what drives certain behaviors like anxiety, depression, certain minerals and certain hormone levels, your thyroid, how it's all interactive. And it's amazing when you see someone will arrive and I'm always so impressed by the science, and it is the science behind the mental health that's driving it. Lionel, what you just said, it's driven many ways because there's stresses and trauma that start stressing our body. But whenever you have that doctor sit down and she says, well, this is out of line and this drives, a psychotic tendency, and it's beautiful to actually have someone who never had someone explain that to them start understanding what they needed to do to take care of themselves and seeing a transformation when someone is ruminating and can't stand still to meeting them 30 days later and having a conversation and seeing them and how different it can be when we get imbalances that are going on put in check. Now, it's not always, like you said, it doesn't mean that it's saying no medicine is ever needed, but the reliance is not so harsh on a heavily medicated individual, and sometimes they don't need it. So your work and starting the Institute, I love the idea that there's going to be 10,000 people because there's nothing more debilitating than to have a person call and not have an individual be able to come to us, but realizing now there's 250 new doctors that are trained in this, that there's getting to be an evolution that's happening of doctors trained. And you were joking because you were concerned you had your workout equipment behind you, but you live it. Yeah. So, everyone kind of goes through that path where all of a sudden they realize this is super important and life-changing. These tools are life-changing for people.
Well, I think it's a much more empowering message for people who are seeking care to talk to them about the various possible root causes of their suffering rather than, to say, well, to just parrot back what a pharmaceutical rep might say of, well, you have a serotonin issue and here's your serotonin thing, which has never been borne out by neuroscience at all. So unfortunately, in our field, there's still a lot of people who haven't gotten updated with the information. And so, when I was coming through training, the message was, well, tell people to stay on their meds because, that's the treatment. Like let's say for bipolar, like there's no alternative to medications. There's nothing else you can do for someone other than for them to take their Depakote and lithium and, their antipsychotic or whatever. And I just think it really sells people short, and it can create a block for people to realize their human potential. And I think in mental health care, we don't this is something that we really stand for in the Institute, is actually talking about what is well-being, as opposed to, the more pathological model or the medical model I was trained in, which is, well, if the person is asymptomatic, then we've reached all our goals. Well, if they're apathetic and they have no purpose in their life, and they, are not able to really have meaningful relationships and so forth, like, what is that? Is that the apex of their possibilities in their life? Probably not. So I think we need to take a bigger stand for what actually well-being is, and shoot higher than what, I was taught to shoot for.
Yeah, I agree. My training as a therapist, it's based in abnormal psychology. Even I did a very, very progressive training, but it's still based in abnormal psychology. And so, we have this DSM, and we're categorizing people with these mental health disorders. And it's not that it's wrong, but it's based in bringing people to what we would call normalcy. And normalcy is not necessarily a human's potential whatsoever. Normalcy is like they're functioning. They're out there, and their global assessment of functioning is they're doing okay. They don't have severe mental health symptoms. And right now, we've got a lot of people that aren't even there. They're not even back to normalcy. We've got a lot of people that are very stressed and very anxious or depressed. And we see these numbers increasing over time. And so what Will's speaking to is we just really stand for a medicine that's based in potential, what a person's potential is, and creating a medicine that's about it's a healing modality that can help a person thrive in their life and actually attain their potential. So we're really taking a kind of a different view on what we could do with this aspect of mental health care.
I love that. Honestly, that's, I remember the first time I interviewed Lyle Murphy, who founded Alternative to Meds, and I'm as ADD as it gets. I mean, if you were to say, and I said, Kyle, I spent my whole life, I need to take this, I should have taken this. And he said, well, who says that your behavior is wrong? Everyone has different strengths and different weaknesses. Run with what you are. And the person who is a tendency to be a very OCD personality is a wonderful pair for you, because you're all out there doing visionary, doing this and that. And it's true. I think so often that as a society, we feel like we need to medicate ourselves if we don't fit into what other individuals think is normal or what should be normal behavior. And especially with children nowadays, we see it a lot. But I like that everyone just, it's what your potential is. It's not a chart what everyone else should be. There's no set right or wrong. I always will tell people it's not wrong to take medicine. It's not wrong to decide you want to do alternative things to lessen that dependency and have overall health. Because really what we're talking about is overall health that's being missed within this realm. Nobody talks to people about overall health and how that connects to our brain and relationships and all of that. So I am so thankful that the two of you guys were so inspired to do something that's so needed. It makes me choke up just because it is a difficult job to talk to people, hundreds of people on a daily basis, on monthly, and have limited resources and realize that this world is expanding. And I always tell people it's coming, it's happening. This is happening. There are psychiatrists that are going back to learn integrative approaches to how to help you. And thank you. Thank you so much for doing this. I know our doctors are amazing. We're trying to pull our evidence as well. Because you're right, it's all in the evidence base. Like, how can we prove to the world this is effective? So, and And I need those 250 doctors that have, or people, graduates. I promise my people, I'm like, I will interview every one of those people who have graduated this program and feature them, because the work is necessary and there's people that are out there that are seeking it. And thank you so much. You guys are beautiful, amazing guys.
Thank you.
Thank you.
I continue to send people your way, doctors and professionals. I have doctors that will call me on a regular basis. I've never heard about you. Geez, it'd be great if there was something I could do to get trained. Actually, there is. And I send them your link. I'll say, you've got to get trained, because as soon as you get trained, I promise you, I'm going to send you people. There are thousands and thousands and thousands of people who are suffering needlessly. And it's here. We're no longer, this work is expanding, and it will explode. It's not going away, and it will be evidence-based. And people like you are writing history.
Oh, thanks, Debbie. Yeah, it's really satisfying work, for sure.
It is. Honestly, when you see the outcome afterwards, like I'll see someone that came in, and there's someone that I brought in, and I'll see him in Sedona, and he's walking around and he looks great, and I'll see him and how you doing, and realizing the profound transformation that occurred and what would have happened if he had gone back to another psychiatric stay is night and day. He has a different set of tools. And that's what's beautiful. So thank you. I love your work. We need to pair up. We'll share whatever data we have. We need to work together and do some evidence-based stuff together. So thank you. You guys are amazing individuals.
Thank you, Debbie. It's great to meet you.
Great to connect with you.
Yes, definitely.
Great.
Okay. For sure, I need to get the list of those guys.
Yeah.
Well, because there's times like we may need a new, we're always needing professionals too. So we'd like to be able to, if we can even just send out our human resources to your graduates saying, hey, we're hiring if you want to work with us,
Yeah, we could consider that. I mean, we haven't done that, but we'll definitely consider it.
Yeah. And then I know Lyle had talked too that he would like to be able to do some evidence-based. We've got a brand new EMR that's on, because we're small, we have 16 beds, but we're talking about expanding. So we're doing
the 16-bed facility. Yeah. Nice.
Great.
Yeah. We were waitlisted several times, COVID, but yeah, I would love to see us have it be different locations would be related to income. So like the program be the same, it'll just be different locations based on affordability. Obviously, you don't have money. We have a location in Ohio,
Yeah. Great.
not in Sedona, but in Ohio. So we're working on it. With any luck, I'm going to make sure that we get there.
Make sure you send us your info too, because
we will.
People often ask us, because I think, inpatient obviously, could vary a lot from one facility to another. And it's really important for our folks to know what the resources are that are in alignment with their values as practitioners, because it just, it sucks when someone, goes in the hospital and gets put back on all the things that you were working to get them off of. And
that happens a lot, actually. I'll get people that will call me after they've gone to CR Tucson and they thought they were going in for an integrated, program. Right. But yeah, we have Dr. Britz. You need to connect with her. She's really quite amazing. I think she'll fill auditoriums someday. She's really great. But yeah, we have the gut-brain health diet, orthomolecular, functional medicine testing is the foundation of everything. Environmental medicine, they do 5 days a week. They do various forms of detox protocols to help with any environmental things that would block, the absorption. Right. We brought on NAD. Dr. Lee wants to bring in ketamine. I see that you guys do that. Yeah. You've had a lot of luck with ketamine.
Yeah, it's been really powerful.
Really?
It's a game changer for sure.
Is it?
Yeah.
I'm going to have Dr. Lee get in
depression.
contact with you.
For depression.
Yeah.
Yeah, that's what we were. Well, I've heard it the same when they use it in conjunction for eating disorders.
I'm hearing about that. I haven't looked at the literature on that yet, but people are definitely asking about it. So maybe there were some recent papers on that.
Yeah, I know a neurochemist that's up in Salt Lake, and she's actually had quite a bit of success with people who have had long-term eating disorders, and they bring on ketamine in combination with amino acid therapy, and it's been a game changer. Apparently, it's like people who have had like 20 years of eating disorders. So yeah, Dr. Lee is going to be looking into doing ketamine, so we're going to be adding that, and then of course we have hardcore trauma treatment. So it's trauma treatment and exercise. So it's all the same foundation that you teach. That's why.
Yeah, sounds very aligned. Yeah.
That's what happens is that when you said it, I was like, when I have to go refer somebody, I'm like, okay, well, it's a psychiatrist that does mindfulness, which that's great, but there's no functional medicine component to it. So when I go to refer someone, it takes me a lot of time before. I don't do that really lightly. I'm like, well, it's really important. You need to make sure that they have all of these aspects dialed in. And I'm always telling people too, I'm like, and do not take yourself off the meds. Don't take yourself off the meds.
Don't start there.
Do not start there. That's usually, a matter of fact, I should have this time, because people will instantaneously, especially males, young males, they're impotence. They're like, I met a girl. Take themselves off the meds.
Right.
I said, you have to listen to me. We're here to support you. But you do that, you can't come here. We got to be stabilized, so we can do our thing. So anyways, it was so nice meeting you both. I'm sure Lyle would like to connect with you guys to be able to do some more, maybe case studies. He had talked about it. And Dr. Lee has talked about ketamine, so I'll have him connect with you.
Great.
See what you guys think. I know he's talked about bringing that on. So yay! All right, cool.
Yeah.
Thanks so much. It was great meeting you.